Okay, hello everybody. Dr. Erickson with Executive Health Solutions. Wednesday morning. How's everybody doing? Elbow pain, specifically lateral elbow pain. Okay, what is it? Tennis elbow, lateral epicondylitis. There's some different words for it, and commonly that is the grouping that any kind of lateral arm pain falls into. So I need to explain this to you. The question came up over Easter. A family member is having some exquisite pain on the outside of this elbow here, upper part from here, kind of down, very point tender right in this area. So there's the point of the elbow called the olecranon just up here, where what's called the radial ulnar joint and the lateral epicondylitis, or sorry, the lateral epicondyle, where those muscles attach. That's where it's sore. Okay. That's fine. That's a common thing. That happens all the time. But the trick is differential diagnosis to figure out where is it coming from. What is it? Is it actually the muscle tendon structure, the musculotendinous structure of the lateral? You see all those muscles move right there when I move my fingers? So the muscles that have a common extensor point and attach, they move the wrist into extension and the fingers, and they work with the power grip. So is it that? Or is it deeper in the actual elbow joint, a joint problem as compared to a musculotendinous problem? Or, now it doesn't happen very often, every once in a while, so you might see this a couple times a year. Is it a lower cervical problem that no one's even checked? You go in and say, oh, my elbow hurts. Doctor throws some anti-inflammatories to you, a couple stretches, a brace. Here, try this, you'll be fine. The problem with that is many people are not fine. It doesn't go away. It's no different. So you have to first think about the symptoms and what's making it better and worse. How did it come on? What changes it? If you're one that you're not moving your arm much at all, you're on a computer, you're typing, you're not lifting, twisting things, you're not doing a whole lot, and that is what causes this pain to come on, or it even can be higher in the arm, or it goes lower and you feel numbness or tingling or weird feelings in the thumb or the first finger, second, third finger. That more than likely you have to address or at least screen the lower cervical spine. And it's worth doing anyway. It takes 5 minutes, and if nothing changes, fine, move on to the elbow joint and then differentiate between the actual joint and the musculotendinous structures that are on top of the joint. But at minimum, I'm gonna turn my chair sideways. At minimum, if I have pain with my left arm, if I have pain out here on that part there, and let's say it's up in here sometimes, especially if it comes and goes, it's random, it's not consistent. Sometimes I can pick things up and it doesn't hurt, and then sometimes I pick things up and it's really bad. Or like I said, I'm reading a book, my head is down, or I'm typing, and all of a sudden it's coming on. Well, I'm not moving my elbow much, and I got to check this out. So at minimum, take 5 minutes, work into retraction, extension, push, back. Okay, that's on the camera. No, I'm not. Okay, this way, here, okay, this way. All right, a good 10, 12 of those to at least rule out the lower cervical spine. It takes you 5 minutes, and you never know. I see that, this problem often, and a couple times a year. We check that out, and it's like, oh, I can squeeze, I can lift things up, the pain's gone. It'll go pretty quick if it's there. Now, let's just say for the purpose of this video, that's not the problem. The problem is something in the elbow, either in the joint or in the musculotendinous structures. Now, to differentiate, I'm going to share the screen here because I want to show you. Let's look at this here. Okay, so here's the lateral elbow, right? So we got, and I'm going to draw on this if this will let me. This would be so cool if it'll let me do it. Move this out of the way. Here we go. I want to draw on this thing. Okay. So in this, you can see that here's the lateral epicondyle. This is this bony ridge right here, where the common extensor tendons, all right, from all of these muscles in the back of the arm, all of those guys. attach. And then here's the bony part, called the olecranon. That's where like the tip of your elbow is. So it could be there. There could be a problem there. But then look, you can't really see it very well, but look underneath here. I'll draw it out. Here is the radial head right there. And you can kind of see him underneath the muscle. See that bone right there? So that creates a joint right here. Here's the humerus as it comes down. And there's a joint. And there's a joint, okay? The radial, so the ulnar humeral right there, part of it that's actually like the hinge that moves it. And then the radial ulnar and radial humeral joints, there's two of them right there. That's what creates the ability for your wrist and hand to spin. So you can put your palm up, palm down. So we have to at least assess and look deeper underneath these muscles and see if maybe it's an elbow problem, like deep in the joint, and not just a musculotendinous problem. All right, and the easiest way to do that, and that part of that is just asking, some symptoms and figuring out what's going on. I'm gonna stop the share now. Okay, it's okay. So when I looked at his elbow over the weekend, and this is something you commonly see as well, if you compare each side, maybe this is my right side, maybe this one goes, all the way straight, no problem. And maybe on this other side, it's like, ooh, it hurts and it doesn't go all the way straight. There's a block or a loss of motion. Well, thinking to yourself, okay, anatomically, if there's a loss of motion, if it was purely just a musculotendinous problem, it's not going to stop the motion of the joint, because the tendons and muscles are extra articulated outside the joint. You would still have full motion. It would hurt to resist this way, or to grip, or to pick things up. That's going to cause the pain. But to actually have sharp increased pain with extending the elbow and it feels locked and you can't get it straight, that's suggesting that there's probably a deeper problem in the elbow joint itself. So to differentiate that and to figure that out is you're going to have to take that elbow and go ahead and just go straight, let it go straight, pressure on, pressure off, pressure on, pressure off. And you're going to have to keep, it's easier to see that way, it's easier to see this way, but you got to go straight, 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 and then relax. Straight, 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 and then relax. As you keep doing that, you're going to see if it starts to loosen up and feels like you're gaining motion as you do it. And then retest the things afterward. Do 10 or 12, sets of 10, sets of 12, but a couple times, 3-4 times, get a good 30 or 40 of them in to see if there's a difference. So then afterwards, if you can, now it's not as painful to lift that thing up, or it's not as painful to grip or to twist, and then you're onto something. There's something inside the joint you got to keep going, and eventually you'll probably have to go a little bit faster with a little bit more either speed, or we'll have to load, there's a desk right here. I'm putting my hand on top of a desk. You can see the edge of it right there. And so I'm putting my hand there. I'm leaning into it. I'm leaning down, putting some weight down on the desk, and then I'm pushing my hand forward to get that elbow to go kind of into a little bit of a hyperextension. But start with just going straight, 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 straight. And over the course of a couple of days, if it starts to feel easier to pick things up in the wrist and it's not as painful, it's probably a joint problem. Now, if you've done that and you've tested it and you're like, no, it's really not any difference. It still hurts when I grip. It still hurts when I pick things up this way. Okay, then we may be falling more into the bucket or the group of a musculotendinous problem, probably some kind of dysfunctional problem. Activity was increased at some point. Something happened where you irritated or disturbed, slightly, strained some of those muscles and tendons there. As your body's trying to scar that down, we want to make sure that it scars down appropriately. So you're going to have to remodel that tissue. Rest alone, if you just rest it, it will heal, but it won't heal appropriately, and then you run the risk of down the road, months, years, you're doing things that comes back again because that tissue is never actually scarred down correctly. Actually, let me see. That might be a picture of another way to look at that. I'm going to find some of the fibers in the elbow. Here we go. Here, look at this one. Let's just share that screen again. Okay, so here, you see how there's microscopic tears in the tendon. So the muscle is here, it turns into a musculotendinous juncture, and the tendon attaches to the bone. Well, if there's little micro tears in that tendon, with time that will scar down and heal. But if you don't remodel that appropriately, so those, see those, the way the lines go, nice and parallel, if they're kind of all jumbled up like a spider's web, it's not healed right, and it could happen again. So we don't want that to happen. So we're gonna figure that out. So to start that, then we would work on kind of, east. So first, elbow straight, since it's not a problem. That's what we work on the tendon now. And then go ahead and lengthen the tendon and let it come back up. So we're stretching now, just trying to lengthen the tendon a little bit. Okay, we can work on that. And then you'd want to remodel it, you have to progressively load the tendon. And to start, because it's painful, you'd want to do it eccentrically, or which would be negatively. So that would mean in a case where I got a 1 pound weight, real light, it's down. I help lift it up with my other hand, okay? And then I negatively lower it down, slow, slow, slow. It's probably gonna be better if I'm on a edge here like this. Let's go this way. You can see like if I'm on my knee here, so I'm gonna go even lower. It doesn't fall over. So here, I'm gonna lift it up, and I'm gonna just slowly let it down on its own. So this would be eccentric loading, because I'm letting the negative come down. I'm not using the muscle to lift it up. I'm using the muscle to slowly and controlled lower it down. So then we'd go through that eccentrically. And then eventually, a few weeks, of working on those, and then the stretching, that's not gonna hurt to do anymore. Well, then you gotta up the weight. You gotta go from a 1 to a 2 or a 3 or a 4, and then we could probably do concentric, and eccentric, both sides. You gotta turn it on a little bit. It's gotta hurt maybe, 4 or 5 out of 10 pain to do it, as long as once you stop and you rest, and you kind of let it, rub on it, and it's got to calm down within, a few minutes. It can't keep you up at night. It can't be really achy, or then we introduced an inflammatory phase and we have to start all over again. But it's that'd be counterproductive. But it is productive to load that tissue in incrementally more load and intensity to get that thing to scar down and heal appropriately. So we'd start, if it's really painful, with eccentric, where you just do the negative. And then as it gets stronger, it's not hurting you anymore as much. Then, if it's not a 4, 5, or 6 pain doing that, you got to get more weight. You got to turn it on to about a 4, 5, or 6. And then, oh yeah, there's a 6 pain there. Okay, it's a heavier weight. Keep going, keep stretching. And that's how you'll eventually get that thing to the tendon or the muscle or the musculotendinous juncture where it combines to scar down appropriately, and then that pain will be gone. But remember that when someone just says, it's tennis elbow, it's epicondylitis, it may be, but it may not be. So if you had, I'm wearing the brace, I'm doing the things, it's just not getting any better, it's no different, then you have to look at, first probably screen the cervical spine, then look at the elbow joint itself, deep inside, it masks. It's the same pain, the same location. It hurts right in here, but you'll have a loss of motion. You'll have that mechanical loss. You can't get it straight, or you can't get it all the way bent. So then you got to work on, I would try that way first, straight. And then if it's not there, then it may actually be, a muscle tendon problem. And then we want to just make sure that and then because you're just resting it, that's not going to quite fix it. You have to progressively load that tissue with more and more intensity and weight as it heals, so that it scars down appropriately. Okay, so that is an explanation and some basic treatment for lateral elbow pain, tennis elbow, lateral epicondylitis, all the terms that you hear on those. I think that'll get you going. If you have any questions about it, or need any more help or advice, just put comments below. I'll get back to you. We'll figure it out. Check out another website, www.exechealthsolutions.com. There's links to email and stuff there. I'll probably post this in one of the blogs as well, just to help as many people as possible that are having this pain and don't know what to do. Okay, again, Dr. Erickson with Executive Health Solutions. Thank you very much.